I need to tell you something, and I need you to actually listen, not scroll past this. If you have Sjogren's, there is a swelling in your jaw right now that your body is trying to tell you two completely different stories about. One story is boring. One story is not. Put 3 fingers right here. This is how you tell the difference. And I promise you, by the end of this, you'll know something most people with this disease are never told in their appointments. Here's the thing nobody explains well. Swelling is actually really common in Sjogren's. Most of it is completely normal. But there's a small percentage of cases where it's your body flagging something that needs a doctor's eyes on it fast, and the two can feel almost identical if you don't know what to check. So I'm going to walk you through the 3 checks I wish someone had shown me on day 1, and then I'm going to tell you exactly what happens after you find something worth mentioning, because that part is almost never explained either. Before we get into the checks themselves, let's quickly talk about what's actually going on inside that gland, because understanding the mechanism makes the checks make sense, instead of feeling like a superstition you're just supposed to trust. If you keep leaving appointments remembering symptoms you forgot to mention, I made a Sjogren's symptom map to help you track the full pattern. Comment symptom map, and I'll send it to you. Sjogren's is an autoimmune disease, which means your immune system, the system that's supposed to be out there fighting infections, has started treating your own moisture-producing glands like they're the threat. In the salivary glands, especially the parotid, which sits just in front of and below your ear, immune cells, mostly a type of white blood cell called lymphocytes, gather inside the gland tissue and cause ongoing, low-grade inflammation. That's what gives you the dryness, and it's also what gives you the puffiness and swelling that comes and goes with your flares. It's your immune system, camping out in the gland, doing what it does, just aimed at the wrong target. Now, in a very small number of people, over a long period of time, that constant immune activity inside the gland can create the right conditions for something else to happen, for one small cluster of those immune cells to start growing in a way that isn't normal immune activity anymore, it's abnormal cell growth. That's the lymphoma we are talking about. It typically starts as what's called a malt lymphoma, which stands for mucosa-associated lymphoid tissue, a slow-growing, often very treatable type, and it tends to start exactly where the chronic inflammation has been happening the longest, inside the parotid gland itself. This is why the parotid, more than any other gland in your body, is the one worth learning to check properly. So, first check. Texture. This is the single most useful thing you can teach your own hands to notice, because you are checking this gland far more often than any doctor ever will. When Sjogren's causes a normal flare, the swelling in your salivary glands tends to feel soft. Tender, sometimes, especially if you press. It moves a little under your fingers, the way tissue does when it's inflamed but healthy underneath. And here's the tell that matters most, it changes. It's puffier in the morning, calmer by evening. Worse after a rough night's sleep, better after you've been hydrating well. It fluctuates with your disease activity, the way a flare should. Now, the swelling that needs attention feels different in a way your hands will pick up on before your brain fully processes it. It's firmer. Rubbery is the word most patients land on. Sometimes it doesn't feel attached to skin at all, it feels stuck to the tissue underneath, like it's rooted rather than sitting on top. And critically, it doesn't change. It's the same Tuesday as it was last Tuesday. 2 weeks later, still the same, maybe slightly bigger. I want to be really clear about why this distinction exists, because it's not just texture for texture's sake. Persistent, non-fluctuating swelling in a salivary gland is one of the specific signs rheumatology guidelines flag for follow-up in Sjogren's patients, because a small subset of people with Sjogren's have an elevated risk of developing that malt lymphoma we just talked about, and it shows up first as exactly this: a firm, fixed mass in the gland that used to just puff up and calm down like everything else. I need to say the number here, because I think it actually makes this less scary, not more. About 95% of people with Sjogren's will never develop lymphoma. This isn't about living in fear of your own neck. It's about knowing the 2 or 3 signs that separate, this is my disease doing its normal thing, from, this needs an ultrasound. Here's a simple way to build this into your routine, so it's not something you're doing anxiously, but something you're doing the same way you check the mirror before you leave the house. Pick a consistent time, after your morning coffee, before bed, whatever fits your life, and gently press along both sides of your jaw with 2 or 3 fingers, right where the gland sits. You're not looking for pain. You're building a mental map of what is my normal, so that when something is off, you know it immediately, instead of second-guessing yourself for 3 weeks first. So, right now, wherever you are, press gently on that gland. Does it give? Does it feel tender and soft? Good. That's Tuesday normal. If it feels hard, rooted, and it hasn't been that way before, that's the one you make a note of. Second check, symmetry. And this one is almost embarrassingly simple once you know it, which is probably why nobody tells you about it. Sjogren's, by its nature, is a systemic autoimmune process. It doesn't pick a side. So when your salivary glands flare because of the disease itself, it's very typically bilateral. Both sides puff up, maybe not perfectly evenly, but both are involved. You might notice it more on one side because that's the side you sleep on, or the side you chew on more, but if you actually check, both glands are usually doing something. A one-sided swelling that stays one-sided, and stays enlarged for weeks rather than days, is a different pattern. That asymmetry matters clinically because it stops looking like the disease's usual, evenly distributed dryness and inflammation cycle, and starts looking like something localized, a single site doing something the rest of the gland tissue isn't doing. That's the pattern that gets described as a mass, not a flare, in a doctor's notes. To be fair to your own anxiety here, one-sided swelling isn't automatically bad news, and there are a couple of much more common explanations worth ruling out first in your own head before you spiral. Infections of the parotid gland, which are common in Sjogren's because dry mouth reduces the natural antibacterial flushing of saliva, are also frequently one-sided. Those usually come with redness, warmth, and real pain, sometimes even a fever, and they resolve with antibiotics or basic care in days, not weeks. There's also something called a salivary stone, where a small calcium deposit forms inside the duct and physically blocks saliva from draining, that causes a very specific pattern of swelling that gets dramatically worse right when you start eating, because that's when your glands are trying hardest to produce saliva, and then eases off between meals. Both of those are one-sided, both are common in Sjogren's, and neither one is the pattern we are actually worried about here. So one-sided plus painful plus fast onset plus getting better with basic care, that's probably an infection. One-sided plus dramatically worse at mealtimes, that's probably a duct stone. Neither is the red flag. The pattern I actually want you watching for is one-sided plus painless or mildly tender plus it is still there in 3, 4, 6 weeks, not tied to meals, not improving with the usual things that help your flares. That combination, asymmetric and persistent, is the one clinicians specifically use as a trigger for imaging, because it breaks the pattern the rest of your disease normally follows. Third check, and this is the one almost nobody does, because we are all so focused on the jaw that we forget the swelling doesn't have to stay in the jaw. Slide your fingers down from under your ear, along the side of your neck, all the way to your collarbone. You're feeling for anything that shouldn't be there, small, firm, pea grape-sized lumps under the skin. These are lymph nodes, and in a body fighting off a cold, they swell temporarily and then go back down within a week or two. Completely normal, completely expected, not what we are talking about here. While you're doing this check, cover both sides of the neck, just under the jaw, along the sides down toward the collarbone, and don't forget the area right above the collarbone itself, sometimes called the supraclavicular area. That specific spot, right above the collarbone, is one clinicians pay particular attention to, because lymph nodes there are less commonly reactive to everyday infections and more often worth a closer look when they're enlarged. What you're checking for is different from a cold-related swelling. Lymph node swelling in the neck, above the collarbone, or really anywhere, that is still present past the 4 to 6 week mark. Persistent means something different to your immune system than temporary. A lymph node that's still enlarged a month and a half later isn't reacting to a passing infection anymore. It's telling you something ongoing is happening nearby, and in the context of Sjogren's, that's specifically worth mentioning to your rheumatologist, not just your GP. If you want to know what else tends to travel with that kind of persistent node, not to diagnose yourself, just to know when to move faster, it's usually a cluster, not a single symptom. Fatigue that's heavier than your usual Sjogren's fatigue. Fevers that come and go without an obvious cause. Night sweats intense enough to actually soak through what you're wearing. Losing weight without trying to, especially if it adds up to a noticeable amount over a few months. None of these individually mean anything alarming. They're all things that happen for 100 boring reasons too, from stress to a totally unrelated virus to just a rough season of life. But that cluster, alongside a lymph node or gland swelling that's stuck around for weeks, is the combination that moves this from mention it at your next appointment to call this week. Now let's talk about what actually happens if you do call, because I think a lot of the fear around this comes from not knowing what the next step even looks like. It's not as intense as your imagination is probably making it. The first thing your doctor will usually do is look and feel, the same way you just did, but with more experience behind their fingers. If they agree something's worth a closer look, the next step is almost always an ultrasound of the salivary gland. It's quick, painless, no needles, no radiation, and it lets them actually see the internal structure of the gland instead of just guessing from the outside. Ultrasound can often tell the difference between ordinary inflamed tissue and something that looks more like a distinct mass, just from the pattern of the images. Alongside that, they'll usually run some blood work, not to scare you, but because certain markers can add useful context to the picture. Things like your complement levels, which is a set of proteins involved in immune activity, or the presence of something called cryoglobulins, or general markers of ongoing immune overactivity. None of these tests alone diagnose anything. They are pieces of a bigger picture your rheumatologist is building, the same way you were building a picture with the 3 checks. If the ultrasound shows something that genuinely looks different from the rest of the gland, the next step is usually a needle biopsy, a small sample taken with a fine needle, often guided by the ultrasound itself, so they know exactly where they're sampling from. This isn't surgery. It's done in an outpatient setting, it's over quickly, and it's the step that actually gives a definitive answer instead of more guessing. Most of the time, this whole process ends with reassurance. Inflamed tissue confirmed as inflamed tissue, nothing more. And on the occasions where it doesn't, catching it at this stage, through a mass that's still small and localized to the gland, is about as early and as treatable as this type of lymphoma ever gets found. Let's talk about what you can actually do in the weeks between checks, because waiting around and just hoping isn't a satisfying answer, and it doesn't have to be your only option. A warm compress, held against the gland for 10 to 15 minutes, a couple of times a day, can genuinely help with ordinary flare discomfort. It encourages blood flow and can ease the tightness that comes with inflammation. Gentle massage helps too. Using 2 fingers, start behind the ear and stroke downward and forward along the jawline, toward the corner of the mouth, in slow, repeated motions. This isn't about pressing hard. It's about encouraging saliva to move through the ducts instead of sitting stagnant, which is part of what makes stones and infections more likely in the first place when your mouth is already dry. Staying genuinely well hydrated matters more here than people usually give it credit for, not just for comfort but because saliva flow is part of what naturally flushes bacteria out of the gland and duct system. Sugar-free lemon drops, or anything that stimulates saliva production without the sugar that feeds bacteria, can help keep that flow going through the day. Some people find alternating warm and slightly cool compresses genuinely soothing during an active flare, though that's more comfort than treatment. None of this replaces your prescribed treatment plan. Obviously, this is what you do alongside it, in the ordinary day-to-day management of your disease, not instead of anything your rheumatologist has already put in place. I also want to talk about tracking, because this is the piece that turns the 3 checks from a one-time video you watched into something that actually protects you long-term. Keep it simple. A note on your phone works fine. You don't need an app or a spreadsheet. Just a quick line every week or 2. Which side, how it felt, whether it changed. Left side, soft, better by evening takes 4 seconds to type and it means that 6 weeks from now, if something's different, you're not relying on memory to know that. You have an actual record, and that record is exactly what your doctor wants to hear when you walk in and say here's what's changed. If you do end up in that appointment, here are a few questions worth having ready, because it's easy to blank in the moment. Ask specifically whether an ultrasound of the gland is appropriate given what you're describing. Ask whether they want to check your complement levels or run any additional blood work given your history. Ask what the plan is if the swelling hasn't resolved by your next visit. Get an actual timeline, not just keep an eye on it. And if anything about the explanation doesn't make sense, ask them to explain it again in plainer terms. You are allowed to fully understand what's happening in your own body, and a good rheumatologist will want you to. I want to clear up a couple of myths I hear constantly in Sjogren's communities, because they cause a lot of unnecessary fear in one direction and a lot of unnecessary complacency in the other. Myth 1, if it doesn't hurt, it's not serious. Actually, it's often the opposite. The swelling pattern's worth paying closer attention to are frequently painless or only mildly tender, because there isn't the acute inflammation that comes with, say, an infection. Pain is often reassuring, not the other way around, since sharp pain and redness usually point toward infection, which is very treatable. Myth 2, I'm young, so this doesn't apply to me. Sjogren's-related lymphoma risk isn't limited to any one age group, and while risk factors do build up over time with the disease, that's exactly why building the habit of checking now, whatever age you are, actually matters more, not less. Myth 3, if my last ultrasound was clear, I don't need to keep checking. A clear scan is a snapshot of that day. This is a chronic disease, and the recommendation isn't a one-time check, it's an ongoing awareness, the same way you wouldn't stop checking your blood sugar just because last month's reading was fine, if you were managing diabetes. Myth 4, swelling in Sjogren's always means the parotid gland specifically. Actually, there are several other salivary and moisture-producing glands that can swell too, the submandibular glands under the jaw, the smaller minor salivary glands scattered through the mouth and lips, even the lacrimal glands around the eyes. The parotid gets most of the attention because it's the largest gland and the one most associated with the lymphoma risk we've been discussing, but if you notice persistent swelling anywhere in that general area, under the jaw, around the eyes, it's worth mentioning too, even if it doesn't fit the exact 3 fingers under the ear spot we started with today. Myth 5, if I've had Sjogren's for decades without any of these signs, I'm basically in the clear now. Risk doesn't work like a countdown that runs out safely. It's more like an ongoing, low background probability that's worth the same 30 seconds of attention whether you were diagnosed 6 months ago or 20 years ago. Long-standing, well-controlled Sjogren's is still Sjogren's, and the habit is worth keeping for exactly as long as you have the disease, not just in the early years when everything feels new and uncertain. Let's run through a few questions I know are sitting in the back of some of your minds right now, because I'd rather answer them directly than have you go searching for answers at 2 in the morning. What if I check and I genuinely can't tell, it doesn't feel clearly soft or clearly hard? That's completely normal, and honestly it's the most common outcome. You're not being trained to diagnose yourself, you're being trained to notice change over time. If it's ambiguous today, that's fine. Write it down, check again in a week, and let the pattern over time tell you more than any single check ever could. Is it possible to have a completely normal ultrasound and still develop something later? Yes, technically, because this is an ongoing disease process, not a one-time risk. That's exactly why this isn't a check once and forget about it situation. It's a habit, the same way you'd keep an eye on a mole even after one clear dermatology visit. Does a biopsy hurt? Most people describe it as more uncomfortable than painful. A pinch, some pressure, over in a few minutes, usually with local numbing beforehand. It is genuinely a minor procedure compared to what people tend to imagine when they hear the word biopsy. What if my doctor doesn't seem concerned, but I still am? You're allowed to ask for reassurance in the form of an actual test, not just a verbal "it's probably fine." If a specific ultrasound has never been done and you have a genuinely persistent, asymmetric swelling, it's completely reasonable to ask for one directly. You know your own body's baseline better than anyone flipping through your chart for 5 minutes. How big does a lymph node have to be before it matters? There's no single perfect number, which is part of why size alone isn't the main thing to focus on. Persistence and the overall pattern matter more than exact measurements. A pea-sized node that's been there for 2 months is more worth mentioning than a slightly larger one that showed up 3 days ago with a sore throat. What if the swelling is on both sides but one side is clearly bigger than the other? This is genuinely common and doesn't automatically flip it into the concerning category. Ask yourself whether both sides are still doing the same basic thing, softening and firming up together, both moving with your flare pattern, just to different degrees. If they're both fluctuating, even unevenly, that's still consistent with an ordinary flare. What matters is whether one side has essentially stopped participating in that shared pattern altogether and started behaving completely on its own. Should I be worried if I've never noticed any swelling at all? Not at all. Plenty of people manage Sjogren's for years with dryness as their main symptom and little to no visible gland swelling. These checks matter most for people who do experience swelling as part of their disease. If that's simply not part of your picture, there's nothing here for you to worry about. Just keep the general awareness in your back pocket in case that ever changes. Is there an age or stage of Sjogren's where I should be checking more often? There's no universal answer, but it's reasonable to check more attentively during periods where your disease feels more active overall, or if your rheumatologist has ever mentioned elevated risk markers in your blood work. Otherwise, a simple, low-effort habit, noticing during your normal routine, rather than a dedicated, anxious daily ritual, is enough for most people most of the time. I also want to say something about the emotional side of all this, because I don't think health content talks about it enough. Living with a chronic autoimmune disease already means you're constantly interpreting your own body's signals. Is this fatigue normal? Is this pain a flare or something else? Is today a good day or a warning sign? Adding "and also watch for cancer" to that list can feel like too much some days. That reaction is completely valid. You're not being dramatic, and you're not overreacting by caring about this. But I'd rather give you 3 specific things to check for 30 seconds every so often, than leave you with a vague, formless worry that follows you around every single day with no way to resolve it. Specific, actionable knowledge tends to shrink anxiety, not grow it, because it replaces "what if" with "here's exactly what I'm looking for, and here's exactly what I do if I find it." That's the whole design behind this video. I want to be honest with you about why I made this, instead of just handing you a checklist and moving on. Most people with Sjogren's live with some level of background worry about this exact thing. Is this swelling normal, or is this the thing I've read about? And most of the time, there's no clean, simple way to answer that question for yourself. You either sit with the anxiety, or you call your doctor every time your jaw feels a bit puffy, which, I get it, but that's not sustainable for you or for them, and honestly, it tends to make people more anxious over time, not less, because every ambiguous flare becomes its own small crisis. The actual research on this is honestly kind of reassuring once you sit with it. The average time between a Sjogren's diagnosis and a lymphoma diagnosis, in the cases where it does happen, is around 7.5 years. This isn't a thing that ambushes people overnight. And the biggest predictor doctors actually track isn't a single moment of swelling, it's the duration of a persistent, unresolving swelling in the parotid specifically. The longer it sits there unchanged, the more it matters. Which means you have time. You have time to notice the pattern, time to get it looked at, time to act. You're not on some invisible clock that runs out the second you feel a lump. That's the whole point of the 3 checks. They're not there to make you paranoid about your own body. They're there so you can tell, in about 30 seconds, whether what you're feeling fits the boring story or the story that needs a phone call. Most days, for most people, it's going to be the boring story. And that's genuinely good news. Let's do a quick recap, because I want this to actually stick with you, not just play once and disappear. Check 1, texture. Soft, tender, and it changes day to day. That's your normal flare. Hard, rubbery, fixed in place, and it stays the same for weeks. That's the one to flag. Check 2, symmetry. Both sides puffing up together, in some rough sync with your flares, normal. One side, staying enlarged for weeks, not tied to meals, not improving, flag it. Check 3, the lymph node map. Slide down from under the ear to the collarbone. A node that shows up and disappears within a couple of weeks is your immune system doing its everyday job. A node that's still there past 4 to 6 weeks, especially alongside fatigue, fevers, night sweats, or unexplained weight loss, flag it. So here's what I actually want you to do with this. If what you're feeling right now is soft, tender, moving on both sides, and it's been coming and going with your flares, that's your normal. Don't spiral over it. If it's firm, one-sided, hasn't changed in weeks, or you've found a lymph node that's still there past 6 weeks, don't wait for your next scheduled appointment. Call your rheumatologist and describe exactly what you just learned to check. Use the words persistent and unilateral. Those are the words that get you seen faster, because they immediately tell your doctor this isn't just describing an ordinary flare. And if you know someone else living with this, send them this video right now, while you're thinking about it. Not because I need the share. Because this is the kind of thing you want to already know before the day you actually need it. Save this, come back to it next time a flare has you second-guessing yourself, and if it helped you understand your own body a little better, that's genuinely the whole reason I made it. I want to close with something that I think gets lost in a lot of health content, which is that you are not powerless in this. A diagnosis like Sjogren's can feel like it hands your body over to a condition you didn't choose and don't fully control, and there's a version of living with a chronic illness where you just brace for whatever happens next. That's not what today was about. Today was about giving you 3 specific, repeatable things you can do with your own 2 hands, right now, without waiting for an appointment, without needing special equipment, without needing anyone's permission. That's not nothing. That's actually a meaningful amount of control handed back to you. If this is the first time you've heard any of this explained clearly, I genuinely encourage you to watch it again, maybe even with your hands actually doing the checks as I talk through them, so the motions become familiar rather than something you're trying to remember from a video you saw once, weeks ago, at 2 in the morning while spiraling about a swollen jaw. Muscle memory matters here. The goal is for these checks to become as automatic as checking a mirror before you leave the house. Quick, unremarkable, just part of how you take care of yourself. And if you're newly diagnosed and this is a lot to take in all at once, that's completely fair too. You don't have to become an expert in your own disease overnight. Bookmark this, come back to it in a few weeks once the initial shock of diagnosis has settled a little, and build these habits in gradually. There's no prize for absorbing all of this in one sitting, and there's no penalty for needing time to get here. If you found this useful, follow along for more of these, the kind of thing that turns a scary unknown into a specific, manageable checklist. I'd rather spend the time explaining the actual mechanism behind a symptom than just telling you to see your doctor, and leaving you to fill in the terrifying blanks yourself. You deserve to actually understand what's happening in your own body, not just be handed a vague instruction and sent on your way. Drop a comment if you've got a Sjogren's question you've been sitting on and couldn't find a straight answer to anywhere else. There's a decent chance it becomes the next one of these. And one more time, because it's worth repeating. Soft, tender, moving on both sides, changing day to day, that's your normal, don't spiral over it. Firm, one-sided, unmoving for weeks, or a lymph node that won't go down past 6 weeks, that's the one you call about, using the words persistent and unilateral so you get seen faster. One last thing before I let you go. None of what I've shared today replaces an actual medical evaluation, and it isn't meant to. Think of it as the layer that sits underneath your care team, the part that helps you notice something worth bringing to them in the first place, and helps you describe it clearly once you're in the room. The 3 checks are yours to use as often as you'd like, in your own home, on your own time, at no cost and no risk. What you do with what you find is always a conversation with your doctor, not a decision to make alone based on a video. Take care of yourself. I'll see you in the next one.